Hello and welcome to the third video of my chronic illness, my last and final. I will not be talking about my conditions from here on out because I want to talk more about patient advocacy and other diseases. Not so much about me, but the nursing stuff. So, as I had mentioned before, I had a gastric emptying study that was abnormal. And with the POTS, they said that I also have gastroparesis. So what is gastroparesis? It is, another term is gastric failure, which means that when you eat, your stomach is not churning the food and releasing the food the way it should. Whether it's, due to nerve impairment or muscle issue, like hypotonia. That's the thing that I can think of. Like if you have like a hypotonic, you're usually hypotonic, you would have difficulty with digesting food. So the symptoms are, you can have nausea, which is very common, vomiting, which is also very common, bloating, pain, abdominal pain, early satiety, or as soon as you eat, you feel full, GERD symptoms, so like heartburn and chest tightness, and the reason for that is because the stomach is, keeping the food in there and your body's trying to get rid of it, and there's some sort of disconnect. So as far as medications, often promotility agents, PPIs. So just an FYI side note, some PPIs can cause gastric delay. So people who are watching this that do have gastroparesis, it's important to do your research. And I'll be making a separate video on how to research because, no, WebMD does not cut it. So anyways, promotility agents, Reglan, domperidone, erythromycin. I know that there's a couple other ones, and I cannot remember for the life of me what they are. A couple of those are actually anti-nausea medications as well. And then as far as lifestyle change, it requires you to have a low-fat, low-fiber diet. Every 2 hours, no more than a cup of food. And the way my registered dietitian has it is I am supposed to eat a solid food and then 2 hours later eat a liquid and then 2 hours later eat a solid. So it gives your stomach some time to kind of rest in between, while still getting the calories that you need. Obviously, this makes it really difficult when it's low fiber because you want fruits and vegetables and be healthy, right? That's kind of the goal. So pureed fruits and vegetables. So I am not ashamed to say that I have eaten baby food. Highly recommend the bananas. So yeah. I think that's essentially it. And as you can imagine, between the POTS and having to drink a bunch of fluid and the gastroparesis and having to eat every 2 hours, it sometimes doesn't compute and it sometimes doesn't work out. And then other times it works out perfectly. So it's an adjustment. I feel like sometimes I'm grieving, as far as, I'm having to make this drastic lifestyle change. And I feel like sometimes I resist, like not intentionally, but, it just gets frustrating. You're like, God damn it, I don't want to do this anymore. I don't want to eat every 2 hours and eat baby food and, eat stuff that I don't want to eat and have all this salt and fluid, and it gets frustrating. So I'm trying to keep an open mind and keep a smile on my face. See that? That's a smile, sort of. Okay, that's kind of a fake one. But sometimes I smile, and you know what? Sometimes I laugh, and I make jokes, and now that I have 2 chronic conditions, and one of them makes me a little salty, I feel like I can make that joke now, right? Like, I don't want to get too salty. So if anybody has any questions, just let me know. But yeah, I will never be talking about these again. I may be talking about how it affects my career in the future. If I do see any sort of significant change where I can say, yes, I can go back to bedside, or yes, I can go back to the office and stand on my feet for, 10 hours a day. But right now that's not happening. So, like I said, if you have any questions, just message me. All right, talk to you later. Bye.